the General Coordination of Food and Nutrition of the Ministry of Health and the Pan American Health Organization. I'd like to welcome the ones who are watching us today.
Antes de iniciarmos a nossa programação,
Before we start today's program, I'd like to share some general announcements on the event. The event has simultaneous interpretation for English, Spanish, and Portuguese. The transmission, the broadcast links, they are available at PAHO's website and in Portuguese at Data's channel. And we have an attentive team to the questions sent to the chat, so please feel at ease to send the questions and comments at any moment. Right now, we're going to start our event that aims at debating the relationship between obesity and economic sustainability of the healthcare systems, as well as the most effective strategies to guarantee a healthier lifestyle. The opening panel will have Dr. Elisa Preto, coordinator of the Technical Advisory Unit of the Social Determinants, Chronic Diseases, and Mental Health of the World Health Organization, and Dr. Rezende, Director of the Healthcare Promotion Department of the Ministry of Health, as well as Dr. Jizei Bertolin, Data Manager of the World Obesity Federation. I'd like to invite Dr. Prieto for her presentation. Thank you, Ana Maria. Good morning to all of you watching us. I'd like to greet Dr. Juliana Rezende, Director of the Department of Healthcare Promotion of the Ministry of Health of Brazil, Dr. Jane Boys, Data Manager of the World Obesity Federation, and I'd like to thank the participation of our panelists and commentators and our moderator. It is a pleasure to be with you to discuss the impact of obesity in the national economies and in human capital and the efficient measures to guarantee a longer and better lifestyle for everybody. The region of the Americas brings one of the highest rates of obesity in the world. 62% of the adults, and they overweight or obesity. In Brazil, the rates are quite high. Over 60% of adults, they are under overweight or obesity category. We have a worrying scenario of a trend of increase in consumption of ultra-processed, which is one of the main risk factors for obesity and non-communicable diseases, such as diabetes and hypertension. The sale and availability of this product have increased in the world, especially in Latin America, and the consumption of ultra-processed by Brazilians has increased during the pandemic, during the COVID-19 pandemic. And besides that, the people with obesity, they suffer discrimination in all areas of their lives, at school, at work, and in healthcare services. For that reason, these people are more prone to depression, anxiety, and social isolation. And this will affect social capital and the health of future generations, besides increasing the inequities, especially in the context of the pandemic. COVID-19 that has impacted social health and in the decrease of active healthcare or sport activities. The only way to advance in the control of obesity is to recognize it as a challenge of all and not only an individual choice. Everybody must act in what the motto says of the Obesity Day theme proposed by the Obesity Federation. Well, to reduce the prevalence of obesity, considering its complexity, it is necessary a sustainable effort and in the long term. This requires public policies that are bold by all sectors of society to change the scenarios of today. All sectors of society must recognize their commitment and raise awareness about obesity and to show that this is not only a result of personal choices. We need to advance integrated policies changes in the food systems that would guarantee good access to healthy food environments, besides the inclusive care for people with obesity, and to strengthen the advocacy, making managers and professionals of all sectors, even lawmakers and all defenders and promoters of changes to revert the growing of obesity. PAHO and WHO have prioritized that agenda in the region. We support the development of actions capable to prevent and control obesity in the countries, such as the nutritional labeling, taxes on sugary drinks, and measures to reduce the prices of healthy foods, public procurement of healthy foods, the restriction of marketing of ultra-processed foods and drinks, the school feeding programs, and the restriction of sales of ultra-processed foods in schools, the priority care of obese people, and the strengthening of the breast milk substitute code. Today we're going to have insights to strengthen this joint work. Thank you very much, and I wish you all a great webinar.
Obrigada, doutora Elisa. Agora,
Thank you, Dr. Elisa. Now, Dr. Juliana Rezende.
Bom dia a todos e todas que estão.
Good morning to all of you present with us. It is a great pleasure that I participate in the opening of this important debate in the World Obesity Day. I'd like to start by thanking our main partners here with us in the opening panel, Dr. Pietro of the Pan American Health Organization, Dr. Janet Pois of the World Federation of Obesity. It is a great pleasure to be with you today and to bring the pleasure that which is to have this seminar that will discuss the relationship between obesity and economic sustainability of the healthcare systems, recognizing the importance of healthcare dialoguing with other parts of society. The National Healthcare Research done in Brazil in 2020 has presented approximately that over 25% of the people have obesity, representing 28% of the population, and 96 million people under obesity. So it is a very important healthcare problem that we need to develop different actions. This health condition brings repercussions in the lives of people, and is risk factor for chronic diseases such as cancer, hypertension, cardiovascular diseases, which requires constant investments and strategies to tackle the scenario. And we have shown the non-communicable diseases platform and the strengthening of promotion of healthcare in Brazil to establish targets for the 2021 to 2030. And so we have the reduction of prevalence in children and adolescents, and the reduction of the growth of obesity in adults. For the success of the actions, I highlight the importance of the municipal and local spheres to have policies that are integrated, sustainable, and based on evidence that can support the management, care, and the people with overweight and obesity, which has been the effort of this ministry, especially this department, and the general coordination of food and nutrition. The Ministry of Health. I'd like to thank all the speakers, moderators, and interpreters that have taken our invitation to participate. I'd like to thank everybody who's following us on YouTube in this important discussion. I wish you all a productive event.
Muito obrigada, Juliana. Agora a doutora Janet Pois.
Thank you, Juliana. Now, Dr. Polis. Please.
Hello, good morning, good afternoon, and good evening, everyone. Thank you. First of all, I'd like to thank PAHO and the Brazil Ministry of Health for the kind invitation to this webinar. It really is a pleasure to be with you all today. My name's Jizei Bertolin, and I'm the Data and Evidence Manager at World Obesity Federation. Our CEO, Johanna Ralston, was hoping to be here today, but she does pass on her apologies. So on behalf of the World Obesity Federation, I would like to express how pleased we are to see this excellent meeting being put together today in the name of World Obesity Day. And I'm sure, as many of you know, the theme for World Obesity this year was Time to Act. And on the build-up to the day, which was on March the 4th, and since then, we've seen many countries around the world take action in different ways. We've seen individuals, countries, and national governments pass new laws, release new obesity strategies, initiate new programs, and share patient stories. World Obesity are extremely fortunate to have a number of members in Brazil, and so we have been delighted to see the multiple efforts being undertaken in the country. But this discussion on the economics of obesity is, in particular, is extremely timely for a number of reasons. So I'll say that World Obesity have been working for a couple of years now to improve the economic evidence related to obesity. We know that overweight and obesity have a number of economic consequences for individuals, for families, health systems, and national economies. And so we have been working very closely with Rachel Nugent and her team at RTI International to develop a new methodology to estimate the economic impact of overweight and obesity globally. And this work in particular has been in part inspired by the excellent study that was completed by OECD, which I know is being presented later by Dr. Michele. I'm very much looking forward to. But the work that we have conducted is due to be published in fall this year, where we will be covering 162 countries. But what we did do last year was publish a pilot paper where we looked at the economic impact of obesity in 8 countries, one of which was Brazil. And what we did find there was that we estimated that the economic impact of overweight and obesity in Brazil in 2019 was approximately 2.1% of GDP, which I'm sure you would all agree is quite a significant amount. And we also estimated in our projections that this is due to rise to 4.5% of GDP if current trends continue. So we have a significant challenge on our hands. And so I'll end my opening remarks by talking about, what is the call to action in light of this emerging economic evidence, in line with the World Obesity Day theme of Time to Act. And what World Obesity are calling for is commitment to evidence-based policies and practices by decision makers, policymakers, and national governments. Now is as good a time as any to recognise that obesity is a complex disease and to invest in obesity monitoring, treatment, and prevention, and to adopt system-based approaches that tackle all the roots of obesity. And at the global level, we will continue our efforts to push WHO for a resolution on obesity. This year in particular, we are hopeful that our efforts in the run-up to the World Health Assembly in May will eventually result in a global action plan on obesity, which will in turn guide national governments into the appropriate action that needs to be taken. There is obviously much to do, and World Obesity will continue to support the efforts of national governments like Brazil. And so we particularly congratulate you on taking the initial steps with this meeting. I'll leave it there and say thank you again for the kind invitation, and I'll look forward to listening into the fantastic event. Thank you.
Muito obrigada, Jane.
Thank you, Jenny. I'd like to thank Dr. Elisa, Juliana, and Jane for the important words on the commitment of the attention in healthcare and the construction of public policies based on evidence. Now, to continue with our event, we'd like to invite Dr. Michele Zecchini, economist, head of the public healthcare in the Organization for the Cooperation and Economic Development, OECD, who will talk about the studies that OECD has been developing on the consequences of obesity for society, the economy, and sustainability of the healthcare systems. Dr. Michele, once again, I'd like to thank you for your presence. You will have 20 minutes for your presentation. Thank you.
Thank you very much, dear colleagues, ladies and gentlemen. It's a real pleasure to be here today with you and contribute to the discussion that you're having, also in view of the Obesity Day. Let me start sharing my screen in the meanwhile and putting on my slide presentation. So, as was introduced, in the next 20 minutes or so, I aim to provide you all an overview of some of the key findings from the study, The Heavy Burden of Obesity, that OECD has carried out a couple of years ago to support the policy making to tackle unhealthy diets and lack of physical activity across OECD countries. Specifically, today, my presentation will focus on OECD AMRO region, which includes Argentina, Brazil, Canada, Chile, Colombia, Costa Rica, Mexico, Peru, and the United States, with a specific focus on Brazil, but many of the findings that I'm going to present are more widely applicable throughout the PAHO region. So the rationale for the OECD to work on this very important topic is that if we look at this region, more than 3 in 5 people are currently living with overweight, and more than 1 in 4 people has obesity. A very alarming trend that we are seeing in the region, but more in general across all OECD countries, is that morbid obesity is growing more quickly than, for example, overweight or obesity are doing. And already currently, 1 in 3 persons that have obesity has in fact morbid obesity, which is the highest level of obesity. So the rationale for working on this is really linked to the risk factors that underpin the rise in overweight across countries. And here are some of the numbers that we have found in a study published a few years ago, specifically looking at Brazil. And when we look at the population in Brazil, 4 in 5 individuals do not consume a sufficient amount of fruit and vegetables.
Não consomem a quantidade suficiente de frutas e vegetais. 7 pessoas em 10 pessoas não praticam atividade física. 23% reportam comportamentos de alto sedentarismo, por exemplo, gasto de tempo assistindo televisão. E uma especificidade do nosso estudo foi que nós tentamos entender, em alguns países da América Latina, qual era o grupo populacional com um risco maior? E, fundamentalmente, qual era o grupo populacional que, em termos de dieta e o estilo de vida de atividade física, qual era o nível mais alto da sua prevalência? E, no caso do Brasil, a área de prioridade para a ação é entre os homens entre 65 anos com baixo nível de educação que moram em áreas rurais. Ora, a razão por que a OCDE está monitorando o sobrepeso em vários fatores é porque, além de ser uma questão de saúde, nós argumentamos que o sobrepeso e as doenças crônicas relacionadas a isso é uma questão de desenvolvimento econômico. E, de acordo com a nossa análise, o sobrepeso, ela diminui a expectativa de vida em todos os países da OCDE e mais em países que estão na região da América, comparado com outros países da OCDE. Então, por exemplo, no Brasil, mais de 3 anos e meio são perdidas em termos de expectativa de vida, mas ainda assim é mais grave em países como México, Chile e Costa Rica. Então, tem uma perca dessa perspectiva de vida em países como Peru, Colômbia, Argentina e Canadá. O impacto é ainda maior quando nós pensamos na qualidade de vida. Além de olhar para a expectativa de vida, olhamos também para a expectativa da qualidade de vida. E vemos que entre esses países o impacto é muito grande na sua dimensão. Como eu disse, os resultados mostram uma carga significativa nos orçamentos de saúde nos países da região.
Of the annual healthcare budget is spent to treat diseases that are linked to overweight and obesity. Diseases such as, for example, diabetes, cardiovascular diseases, cancers, and others. Now, in Brazil, the share of total healthcare expenditure is even higher compared to the OECD average. And for OECD average here, I'm referring to all OECD, so including also countries in Europe and the Asia Pacific region. Beyond this, overweight and associated NCDs carry a significant economic burden for countries in the OECD American region, and also for single persons. As part of our analysis, we calculated that due to NCDs, we have a workforce that is less productive than it would be. This is because people with NCDs have higher days off work for sick leave, they retire earlier compared to persons that are in good health, and when they are at work, they are less productive compared to healthy peers. Finally, we also saw that persons that have overweight or obesity, particularly women, are less likely to be employed and contribute less to the workforce. When we take into account all these factors, the reduced workforce productivity creates a loss in productivity of about $508 per capita per year due to overweight and associated NCDs. In Brazil, this amount is a little bit lower compared to the other countries in the OECD American region at $212.
Dr. Michele, I'm so sorry for interrupting you. I think we are having a problem with the translation of the event to Portuguese, and I will ask the technicals to help us to resolve the problem. Just a second. I'm so sorry.
No problem at all. I wait for green light to restart the talk.
Dr. Michele, just one second. I think we will continue the presentation. Just one second, I'll make a commentary here. A todos que estão nos acompanhando pelo canal de YouTube da OPAS, eu gostaria de dizer que a transmissão está sendo feita corretamente para o português pelo canal de YouTube do DataSUS. O link está disponível no chat, então peço que quem estiver acompanhando pela OPAS em português, se puder acompanhar pelo canal do DataSUS, a tradução está sendo feita corretamente. Dr. Michele, I'm so sorry, you can keep with your presentation now. Thank you.
Perfect. Thanks a lot. I continue. The impact on the reduced workforce clearly down the line has a broader impact on the economy of the countries. And we calculated that the GDP, the economy of countries could be on average 4.2% bigger than it is currently if we eliminated the burden of overweight and associated NCDs. In Brazil, the gain in GDP would be of 5%. One of the issues that we found is that obesity and the associated NCDs not only have an impact on today's economy, but they poses real challenges for the economy and the human capital of future generations. So, for example, we carried out analysis on micro-level data, mainly from European countries, and we saw that children that have overweight or have obesity are less likely to complete the school and have lower educational outcome compared to their healthy peers. So in particular, for example, there is a 58% decrease in chances to have completed higher education at age 29 for boys with obesity. When we take into account everything, including healthcare expenditure, reduction in GDP, there is a sort of tax, a hidden tax that government needs to raise to pay for the reduction in productivity and the cost related to obesity. These were analyses we could carry out only in the United States and Canada, and the average across these two countries is that the citizens pay on average more than $900 every year to pay for the reduction in GDP and gap and expenditure due to obesity. The next step in our analysis was to look at the policies that OECD countries have in place to promote a healthier diet and an active lifestyle. Overall, we saw that OECD countries have a comprehensive set of policies, but there are some gaps that remain. Specifically, we identified three types of gaps. The first one is that policies are too often implemented in forms that are not the most effective. Let me give you an example. While we know that mandatory front of package labeling is the most effective form to steer behaviors towards healthier food when it's bought, only a minority of countries has in place this policy. While many countries have some sort of front of package labeling, only very few have a mandatory front of package labeling. Similarly, when it comes to regulation of advertising aimed at children, compulsory TV advertising restriction are the most effective form. Still, at the time of our study, about 1 in 3 countries had this policy, while 2 in 3 countries went for the voluntary restrictions that we know are less effective. The second area in which countries can improve is that very often there are too limited resources or practical problems that limit the number of individuals that would potentially benefit from the policy. Here, a classical example is the role of primary care, or more in general, of the healthcare system to promote healthier lifestyle. Primary care doctors in many countries have so many tasks and are so little time to spend with the patients that giving advice or promoting healthier lifestyle is not usually at the top of their priorities. There is certainly space, room to do much better on this part. Finally, we are living in an environment that is still too obesogenic and conducive to an healthy lifestyle. There is room for improving the environment in which we live, particularly in the case of cities, but more in general, we need to make the healthy choice the easy choice, which is not always the case today. Based on our assessment of the policy gaps, we try to identify a comprehensive set of policies, in particular in 3 domains: policies that promote health education and health promotion, whether this is prescription of physical activity by primary care doctors, mass media campaign, better labeling, use of new technology, or environmental changes such as promotion of physical activity in schools, promotion of an active lifestyle and healthy lifestyle in workplace, and increase access to active public transport. And finally, regulation, better regulation of food advertising aimed for children. And this package of these policies are policies that we know would close many of the gaps we identified, and for which we have a strong body of evidence suggesting that these are effective interventions to put in place. Usually countries are not necessarily interested in implementing one single policy, but they are also very much interested in implementing packages of policies. And we have also tried to combine these policies into different packages. In particular, we have here 3 packages, the communication package, which mainly look at improving education and regulation, fundamentally everything that is linked to communication. There is a physical activity package, which aims specifically at promoting an active lifestyle, and then a mixed package, which takes a little bit of those policies that seems very promising, but they are still seldom implemented by countries. And specifically, here we looked at menu labeling, prescription of physical activity by primary care doctors, and workplace wellness programs to promote healthy living in the workplace. And here are some of the results for these 3 packages on how they would impact health and economy across OECD countries. Now, as you can see, each of these packages can save tens of thousands of cases of NCDs per year across 36 OECD countries, including the analysis. Specifically, the mixed package would decrease the number of NCDs by about 60,000 per year. They would save millions, in some cases billions of US dollar per year to the budget of the healthcare system, and they would also improve the productivity of the workforce by producing a healthier workforce that can participate to the economy of the country, but even more importantly, would allow people to carry out their own life and caring for those that they love. These interventions are all very good investments for countries in the American region of the OECD and also for Brazil. We calculated the return on investment. Fundamentally, the graph shows you here the US dollar returned in GDP for every $1 US invested in intervention. As you can see, the packages in particular are very good investment with the communication package, for example, that returns 4.6 US dollar for every single dollar invested in this package. We have also looked at a different intervention. Rather than an intervention, we called this a scenario. Fundamentally, when we started working on this project, OECD was supporting the Argentinian presidency of the G20 in terms of policies that could promote a healthier diet. One of the issues that were discussed during a meeting that was organized here at the OECD was the interest of countries in potentially extending the policy that the United Kingdom had put in place with a net target of a 20% reduction in calorie content of calorie-dense food. And based on this, OECD has calculated the impact of achieving this target. Now, a 20% reduction in calorie content of calorie-dense food is an ambitious target, which we think can be achieved only by implementing a package of policies. Countries that have undertaken this way mix a number of different policies, such as in terms of often taxation, incentives to reformulate for industry, regulation, changes in procurement policies, for example. So rather than a policy in itself is a package. But as you can see, the impact of achieving this would be significant. If Brazil achieved this target, our model calculates that we could avoid more than 70,000 cases of NCDs per year in the next 30 years. The impact on healthcare expenditure would be in the order of magnitude of $600 million per year. There will be 95,000 additional full-time workers per year, and the impact on GDP would be 0.5%. And if you think that we are talking about a policy that is a health policy and produce a return on investment, an increase in GDP of 0.5%, this is certainly something to consider seriously because of its impact. Now, I'm leaning towards the end of my talk. The key policy implication of our work. Overweight keeps increasing due to unhealthy diet, lack of physical activity, and sedentary behaviors. Overweight has enormous and raising negative health, economic, and social effects on the society and also on single individuals. I would add for this generation, but also for future generations. Much has been done, but even more needs to be done. We need to strengthen policies currently in place and close policy gaps in certain areas. Policy packages to promote a healthier diet and an active lifestyle, particularly those modifying the environment, are an excellent investment, and reformulation may play a significant role as part of a broader package of policies to promote healthier diet and an active lifestyle. I stop here. You find much of this information on our website, and I'm happy to remain in contact with colleagues in the Amur region and with colleagues of PAHO. Again, thanks for the invitation. It has been a pleasure being with you today. Over.
Dr. Michele, somos nós que agradecemos por você estar aqui conosco hoje.
Dr. Michele, we thank you very much for being with us, sharing such important results of OECD. Let's look into the package of actions that are effective towards healthcare and prevention of obesity and the economic impact that is being observed in the countries. Now I'd like to invite Dr. Amira Shigar. She's a leader in nutrition of the World Bank, and she will talk about the costs of obesity, its impact in human capital, and the path towards a encompassing approach to revert the scenario of obesity. Dr. Amira, thank you very much for being with us. You have the floor, ma'am.
Thank you very much for the invitation. Big thank you to the government of Brazil and to PAHO for the invite. I'm going to try, give me one moment to try and share my screen. Please tell me if you start to see it. Do you see it?
Yes, but not in the full screen mode.
Yes, it's going to full screen mode in just a moment. Here we go. I hope you can see the full screen now.
Yes, perfect.
Okay, thank you again for the invitation. And I lead the World Bank's programs on nutrition across various sectors. I will speak to the health and economic consequences of obesity, and I will actually reiterate many of the comments that have been made by Michele as well. First, to remind us, and just to clarify, I'm going to speak less about Brazil per se, because I think all of you know much more than I do. I will speak instead more to what we have learned from a global level. So reiterating what Michele just said, we have seen a dramatic rise in obesity around the whole world. You see this picture in the 1990s, and as we go forward in the 2010s, you see the picture has changed quite a bit, and we're seeing rapid increases. And today, if we look at the nature of the problem, 1 out of 2 adults is overweight or obese, and 1 out of 5 children are either overweight or obese. So it is a rapidly increasing problem across the world. And what is surprising, I hope you can see the slides as I'm moving them along. What is very surprising is that we always thought overweight or obesity was a problem of rich countries and rich people alone. But in fact, our analysis shows that more than 70% of the overweight obese individuals live in low or middle income countries. That is quite an unexpected experience that we've seen. And the other surprising thing is that 50%, more than 50%, 55% of the global rise in overweight and obesity is in fact in rural areas. So it's not just an urban problem. It's not just a problem of the rich. It is really much more widespread than that. The other thing that we have identified is that as countries' per capita income increases, the burden of overweight and obesity, it shifts towards the poor. So if you see on the left-hand side of this slide, a country like Bangladesh with a GNI per capita of $1,330, you can see that, in fact, it is the richest quintile, so that are most likely to be obese. But as you move to the right-hand side, look at Egypt as an example. It's not just the rich, it's the burden has shifted quite a bit to the poor. So the poorest, which is the lightest green first bar in each country, are starting to share that burden much more than some of the other poorer countries. The other thing I want to remind ourselves is that many countries, and here I share only the Latin America and Caribbean countries, but many countries across the world suffer from what we refer to as the double burden of malnutrition. On the y-axis here is stunting prevalence among children under 5. On the x-axis is overweight and obesity among women. And you will see that many countries have this double burden of both undernutrition and obesity. Now, Brazil, which you see in the middle over here, it has a lower double burden relative to other countries, but in terms of obesity, Brazil has very high burden. And today we cannot have any meeting without a discussion about COVID. And as you know, COVID has led to disruptions in supply chains, and that is leading to increased food prices. And actually the recent developments in Ukraine are adding to that challenge in terms of food prices. COVID has had an impact on incomes of the poor. That has been really challenging for the poor. And then it has led to disruptions in delivery of health and nutrition services, as well as lifestyle changes like sedentarism because of lockdowns. And so what that means is that if you look at the right-hand side of this slide, we have seen, or we anticipate, both increases in both undernutrition and obesity related to these disruptions. And we've done a recent 2020 review with Barry Popkin that shows that obesity actually exacerbates the effects of COVID-19. It increases COVID-related death by 48%, hospitalization by 113%, and ICU admissions by 74%. So where health systems are already challenged, it challenges them even further because of obesity. And if you see, not only does obesity exacerbate COVID-19, but COVID-19 exacerbates obesity as well. And we've seen major shifts in food purchasing patterns, rapid increases in consumption of ultra-processed foods and cheaper foods, because food is becoming more expensive. People will buy cheaper foods, and that leads to increased weight gain as well. At the same time, we've seen decreases in physical activity, economic stress, and all of that leads to greater obesity. So what has caused the rising obesity rates that we've talked about? The recent work that we did in 2020 highlighted some of the factors that affect overweight and obesity. And this is just a conceptual framework. And if you see in the middle of this framework are the direct factors that lead to overweight and obesity. Clearly, diet is one very important part of that. Second is physical activity. I think that is obvious to most of us, but also want to remind ourselves that what happens in early life nutrition and genetics is also really important. So children who are stunted are will often grow up to be more obese and have more negative consequences as a result of what we refer to as abdominal obesity, which is likely to happen with children that are stunted. And then along this framework, we've also identified foods, indirect factors that affect obesity, everything from food systems to urbanization to the built environment that you live in, whether that allows for exercise or not, technology, social norms, cultural norms, trade liberalization, lots of issues affect obesity. We can't unpack all of them, but I think I wanted to share with you how increasing calorie consumption, we are seeing that as a key factor as a result of unhealthy diets. And here you see over here on the bottom, daily caloric supply per person, and on the y-axis, overweight or obesity rates. And you see that in the case of Brazil, so the average calorie supply is about $2,800 for 2,800 calories per person. In the case of Brazil, I hope you can see this, your consumption rates are about 3,200 calories, which is quite a bit more than what is recommended. So that might in fact be leading to that. And that links to the previous presentation where you talked about a 20% reduction in calorie intake and how that could benefit obesity rates. Also, globally, we have seen diets that have shifted and become less healthy. And this is driven primarily by increased consumption of what we refer to as nutrients of concern. And those nutrients of concern are free sugar, sodium, and trans fats. And though sodium may not contribute to obesity per se, but it does contribute to non-communicable diseases like cardiovascular diseases. And then, of course, sugar is linked to diabetes, hypertension, and the like. So these three nutrients of concern are really important, have a huge impact on our health. And as I said earlier, we have seen a rapid increase in consumption of these over time. And much of that is through ultra-processed foods. So beyond obesity, poor diets are also really important drivers of the burden of disease. And these are data from IHME on the burden of disease and the disability-adjusted life years, DALYs as we call them, that are attributable to poor or unhealthy diets. And all the countries that are shown here, much of those in the European part of the world, more than 10% of DALYs are lost to unhealthy diet. Perhaps a little bit less in the Latin America region, but you can see increasing rates even in the Latin America region. So why do we care so much about overweight and obesity? We care because, as has been referred to earlier, overweight obesity is a key component of what is referred to as the Human Capital Index. The Human Capital Index was launched by the World Bank a few years ago, and today we have 80 plus countries that have signed up to the Human Capital Index. And if you unpack that index, very important component of the index is the adult survival rates, which is the fraction of 15-year-olds who survive to age 60. And obesity is a very important part of that index. So obesity contributes to lower human capital over time, and that leads to economic losses, both direct economic losses linked to obesity, but also indirect losses linked through non-communicable diseases. So this slide here shows you the health consequences of obesity. I won't go through the details, but just to emphasize, I think all of you know very well, particularly in the Ministry of Health, that people with obesity are at an increased risk for many NCDs, including coronary heart disease, type 2 diabetes, and many types of cancers, as well as many other diseases as well. And in fact, on the right-hand side of this slide, you see that the number of disease-free years from age 40 by body mass is linked to body mass. So let's look at men over here. And if you see when they are underweight, they have less numbers of disease-free years from age 40 onwards. As weight becomes more normal, you see an increase in the number of healthy years. But this curve goes down again as soon as individuals become overweight and then obese again. Same thing, same pattern you see for women as well. So strong links between obesity and non-communicable diseases. Moving on to the other reason we care about obesity is because of the economic costs. And Michele actually did an excellent job already of laying out these costs that are associated with obesity. But I just want to remind ourselves, and this is actually work done by the World Obesity Federation, that what we often measure are the direct costs because they are easier to measure. The direct costs of obesity in terms of medical costs and some non-medical costs. But it's very hard to quantify the indirect costs, which in fact are the larger part of the costs associated with obesity. That includes premature mortality, dying sooner than we were expected to, and productivity losses. And even with all these challenges, we anticipate obesity leads to losses of about 1 to 2 trillion. Thank you to the World Obesity Federation for this work. And this slide too is from the World Obesity Federation, and it shows that if we don't address this issue, today, or in 2019, we were losing about 1.8% of GDP to obesity and overweight. If we don't address it by 2060, it will be double the losses. And this does not, in fact, take into account additional costs that are associated with water use, carbon emissions, and the like. So, in fact, huge potential economic impacts. Now, that's all been challenging information. Now, I want to move on to what we would like to call the good news. And the good news is that, in fact, there are cost-effective population-level interventions that exist. And many of these have been referred to already. That was part of the work that we did at the World Bank in 2020 as well. And we pulled together a menu of options, very similar to what Michele just presented, that can be adopted and adapted by countries to their own context. So this is not a one-size-fits-all recipe, but every country needs to pick up the interventions that make the most sense within their country context. Everything ranging from fiscal policies around taxation of unhealthy foods, taxation and subsidies, nutrient profiling, limiting access to and marketing of unhealthy foods, working with schools to improve what is done in schools, urban redesign, promoting active transport, promoting the building designs that allow for more exercise, so on and so forth, as well as improving the quality of food through the food system. There's been a lot of discussion on that over the last year or two. And in many countries, scaling up prenatal and early childhood nutrition interventions needs to be part of that package as well. And many of the countries that we are working with are starting to implement these. And the good news is also that we are learning lessons from them. In addition to those, WHO has highlighted some best buys. Three of them are listed here: reducing salt intake, and I referred to that already, replacing trans fats with polyunsaturated fats, and of course, raising public awareness through mass media on diet and physical activity. And again, Michele referred to some of these as well. So every country needs to develop a package of interventions that meets their requirements. As I said, we are learning from countries that are already starting to implement these. More than 42 countries have already implemented sugar-sweetened beverage taxes. You can see some of them over here. And we are starting to see benefits or impacts from these as well. Mexico, for example, implemented a 10% tax on SSBs, sugar-sweetened beverages, and showed a reductions in overweight, or estimated a reduction in overweight, prevention of diabetes, and myocardial infections and strokes, as well as lower deaths as well. So if we do what is required, we can anticipate impacts. And there is growing evidence for fiscal interventions and free sugar. I will not go through the details of each of these, but just to say that there are lots of new studies emerging that show the links between food policies and obesity, and the impact of fiscal interventions in addressing these issues. The other thing I want to highlight is that as countries develop a universal health coverage, a framework for universal health coverage, there is in fact opportunity to include nutrition within that, to address the issue of obesity within that by using those fiscal policies as a revenue-raising component of the health financing arrangements around UHC. And I think most people don't think about this intuitively, but it is possible. And if there's any country that can do it, it is Brazil. And I think you are doing some more on this as well. So we'd love to hear more from you on that. Then the other intervention that's been talked about quite a bit is front of package labels. And again, many countries are starting to do that. In some cases mandatory, in some cases voluntary, but it is starting to happen in many countries. One of the very interesting countries that has done some work on this, actually very successful work, is Chile, who have done a lot of work on nutrient profiling and linked that to front of package labels, marketing restrictions, as well as restrictions on sales in schools as well. And the interesting thing with Chile was that with some of this package that Chile has put together, when this was put in place, that led to a 25% reduction in SSB, sugar-sweetened beverage consumption in schools. But because the marketing was primarily initially targeted to children, regulating advertisements was basically targeted to children, the industry shifted the advertisements towards adults. And so the government went ahead and then further adapted the regulations to cover adults as well. So these sorts of lessons are being learned from many countries. Similarly, on the salt reduction agenda, there are many countries that there is a package very similar, not so far different from sugar-sweetened beverage related package of interventions, and countries are starting to implement these as well. More and more countries are in fact putting in regulations around salt reduction. And the implementation is always uneven when you start a new thing, but it is starting to happen. And I think we can learn a lot from that as well. Similarly, on trans fats, I'm going through this a little bit quick because I realized that time is short. But just to emphasize that there are similar discussions happening in many countries around trans fat as well. And I'd like to hear what is happening in Brazil in terms of trans fat reduction. The other thing that is being discussed, particularly in the West, is around taxation on other unhealthy foods, including those that are high in fat, sodium, sugar. And you see that I've listed here some of the countries that are starting to do it. They're mostly high-income countries, but I'm sure lessons will be learned from that. So in terms of many lessons that have been learned from the implementation that's been done in many countries, one really important lesson is that if you are implementing diet-related taxes, you need to be very careful how these are designed, because the design can have a huge impact on actual benefit from those taxes. So a few of the lessons that we pulled out from what has been done up to now is you want to make sure that you want to coordinate this design of the taxation with other sin taxes as well. You want to make sure that there is a steering committee within the country that guides this taxation. You want to ensure that it is linked with legislation and regulation, and it must be accompanied with a public information campaign so that it is accepted by the wider public as well. And how you design the tax in terms of whether it is on product volume or ad valorem, that also has to be tailored to the country context. Do you want to levy it on the producer or the wholesaler or somebody else? Do you want to implement it as part of a broader strategy, and do you want to consider regional approaches to taxation as well? And last but not least, a monitoring and evaluation framework so that we can learn what both lessons for the future, but also the potential impact. And so that brings me to almost the end of the slide set. You want to document the evidence. You want to consider a regional approach because it's often cross-border tax evasion. You want to implement diet-related taxes as part of a wider health promotion strategy. And you want to coordinate and sequence some of these taxes as part of a larger tax reform package. Those are the things to think about. Again, every country needs to do this based on their own country context, both the epidemiology as well as the political context. So we know that Brazil has already supported many of these strategies, many of these policies, but we know there's much more work to be done. And it's important to recognize that all countries are significantly off track to meet the 2025 WHO targets on obesity. So I do hope we can all help to move in that direction. So with that, let me stop there. Thank you very much.
Doutora Mira, muito obrigada por compartilhar.
Dr. Mira, thank you very much for sharing with us the World Bank views on highlights of possibilities of what can be done for prevention at the public policy level, and also the lessons coming from countries that are implementing these actions and policies. So I would like to thank you for sharing this information and to say that Brazil is quite happy for sharing what we are doing with you as well. And to begin this sharing, this exchange by this event, I'd like to invite for the debate and Q&A session the researchers for Brazil, that is Dr. Leandro Rezende and Dr. Eduardo Nilsson, Dr. Daniela Canella. And before moving to this debate moment, I'd like to say that people that are with us, you can send questions in the chat box. Our speakers will have space for answers, so feel free to sharing questions, make questions and comments. And I'd like to acknowledge the presence of different departments of nutrition and food all over Brazil, and also representatives from Peru and Colombia. Well, now I'd like to first invite Dr. Leandro Rezende, that is the joint professor of the Department of Preventive Medicine of the Medicine School of São Paulo, Federal University of São Paulo, and collaborator researcher for the epidemiological research in nutrition and food from the University of São Paulo. Dr. Leandro will speak on the course of obesity in Brazil and the perspectives for the unified health system of Brazil. Welcome, Dr. Leandro. Hi, Anna. Thank you very much for introducing me. Can you see my screen? Yes, perfect now. Okay. So first, I'd like to thank PAHO once again for the opportunity for being here with you, learning and sharing some information. I'd like to greet our colleagues, the previous speakers, that made my life easier now here with the possibility to move forward rapidly in some initial concepts, but also to bring the first national overview. I bring here any information that we have in our strategic plan, especially for chronic disease, for in 10 deaths for NCD in Brazil are in young people, and they are considerable avoidable. So I bring here the reference that this death can be avoided according to a number of public policies for chronic disease prevention, and within our document in the ministry, we have a guideline for these interventions that are basically focused on interventions on alcohol, physical activity, and nutrition, and also focus on some other metabolic markers such as obesity. We have advanced in some agenda, for instance, the tobacco control in Brazil. We know that it's part of Brazil, and people probably had reached an advancement in the reduction of the tobacco prevalence in male and female groups. It's a reduction that's been increasing through the years, and it requires a close look for the strengthening of public policies. But the obesity scenario is more concerned because since the beginning of the data that you have been following from 2006 has been an increasing in the prevalence of the obesity, according from data from 2019, over 21% of men and women. We know that overweight and obesity are associated with almost 30 chronic disease, and consequently it concerns either both in the standpoint of the health and also in economics, as the speakers showed before. So here, what I'm going to share with you in the next slides is the result of a research project funded by CNPq in Brazil in a partnership with Sugar as well. It's about the cost of obesity in Brazil, where we had estimates of the current cost and future prospections of the obesity causes with the treatment for chronic disease, always looking and considering the unified health system of Brazil. So the results here is the direct costs, as we saw in the previous presentation, that it corresponds to only a share of the total costs that can be attributed to overweight and obesity, but they are shares that are directly disbursed by the federal government through the health system with treatment and care of people living with chronic disease. So these are the first results, the first findings, and next Dr. Eduardo Nilson will present the data on the cost projections of obesity. These results can be accessed through this web link. It is a link that we tried to translate the knowledge generated through this research project, not only in scientific papers, but actually in an interactive dashboard where people can learn about the context, the overview on this epidemic of chronic disease and obesity that we are living, and access to results of this project of research. So this is the main result from the 30 NCDs and health troubles associated with obesity. 6.8 billion were spent in the Unified Health System in 2019, and from the 6.8 billion reais, 1.5 billion is related to overweight. So we can see from this 30 disease, almost 22% of the total expenditure of this with this disease in the health system is through because of overweight. In that web link, you can access the data with this of the cost by disease. So we can see the cardiovascular disease is the major part of the costs. So almost 6,600 million are spent annually with cardiovascular disease because of overweight and obesity. Then we can have respiratory disease and cancer. An expressive number of disease here, as we have diabetes, could be avoided through the control of overweight. Also with the total procedures undertaken in hospital or ambulatory procedures, and also deaths associated with overweight and obesity. I'm not going through details of the disease, but I'd like to invite everyone who wants to access these results. You can access through that link. Another important finding this research project is to map these costs, associated costs considering the number of inhabitants. We identified here what are the states where the obesity cost is higher, or the disease costs are higher associated to obesity and overweight. Especially the states south and southeast of the country, these are the areas where the costs are higher in the unified health system in Brazil. That's what I have to show you. I remain at your disposal, and I'd like to thank again the opportunity for sharing these findings here with you, and once more thank the SNPQ for supporting the research. Thank you very much. Thank you, Leandro, for your presentation. And moving on, I would like to invite Dr. Eduardo Nilsson to present the future scenario and prospections for the obesity events. Dr. Eduardo is a researcher in the Epidemiologic and Nutrition Research Center at the University of São Paulo, and he's a civil servant in the part of the Department of the Ministry of Health, Food and Nutrition. So, Eduardo. Thank you very much. Good morning, everyone. Now I'm going to speak not as a member of the Ministry of Health, but also the university member, because it shows the relationship, the closeness that we have between the institutions to find the best evidence and also to translate this evidence for the policy making. And it's an important role, and as a researcher, in talking about the projections of obesity of this health department, first we have this perspective that the population part of Brazil that shows that is an continuous increasing either from overweight, both overweight and obesity, and from that, part of this project that Leandro said, I am an associated researcher that is a follow-up from it, because in addition to observe the causes and the burden of obesity in Brazil, we wanted to see and assess the impact for the future and think what could be changing, what is the impact of these changes. So from that, here we have data as we have from Leandro and some other studies, but it was the base for the studies I'm going to show you, but it shows the projection of obesity and overweight increasing. So different levels of color showing that there is an increase in overweight and obesity, including the obesity type 2 and 3. So it's a complex landscape, and it affects male and female groups. And here we have the age group, but it's important, and it was said before now international speakers, that there is a higher burden in the adult population between 30 and 50 years old, where we have the higher productivity, so the economic impacts that we will see that will take place are more severe due to this fact. And in addition, when we have different characteristics, we see that's a problem among men and women, and it's quite more severe for women. The age issue that we showed, it's showed within between 35 and 55 age, so it's an economic active population, so with a great impact. And here, particularly looking at the end, when we have the education, it is important to identify the inequality, and showing that the food and nutrition security that is strong in Brazil, that reaches impacts the population with low income, and also with higher prevalence estimated for overweight and obesity, and obesity type 2 and 3. So it's a very concerning scenario, but when we screen the population, considering the vulnerabilities, we find a bigger problem. And here, with a different view on the data that Leon brought before, it's the projects, but now considering the perspective by states, showing that when we have the blue, the prevalence is greater. So unfortunately, the projection here, we name the business as usual, so everything continues as it is. So with no intervention, we continue with the same growth trends. So we see the Brazil painted in blue and even darker in case for obesity. And when we have even the severe charts, we see the same thing. Because when we see as follow-up, as a follow-up in the overweight and obesity, and for obesity type 2 and 3, the risks increases progressively for each of them. So it represents a greater impact in terms of mortality, but also it is translated in cost. So from that, as the preliminary finds that I'm going to show you from these studies is that using these projections, numbers that we have, it shows that, for instance, that the average MC for the adult population, according to age, the increase in projection from 2016 to 2017 was 17%. It is high, and then we foresee that all this group, a total of 11 disease, cardiovascular, diabetes type 2, cancer, they are translated in a global burden of the disease, and from it we modeled different scenarios using this chart, that is life chart projected as it was a cohort through the time, and we use for 10 years because it coincides, it converts with the targets of our plan and chronic disease strategy, just to show exactly if we did nothing, what is a pessimistic scenario, if we're capable to reduce the growth rate by half. So it's not to reduce obesity and overweight, it's just to make the current speed to increase in the scenario 2. That is exactly what we have in our plan as a targeted, that is not increase the prevalence in the adult population. And finally, we found in the international literature in the US, in the Health People Plan for 2030, it's the single country that they found the obesity reduction as a target. So we have the same reduction rate that they have there if you were to apply it here. And among these three scenarios, I'm going to show you the preliminary findings. The first is the most concerning one. According to the results brought by OECD, that when we translated it to the Brazilian specificities, besides this analysis using data and modeling adjusted with national data, is that where we can have the possibility to foresee, for instance, in this 10 years horizon that is severe, because we have been kept in this scenario where is attributed relation to overweight and obesity. 475,000 deaths is a strong burden of cardiovascular disease and cancer and diabetes. And also because we have a great mortality, so we have a population that dies, or also a population that has a disease. It is translated 2.5 million of new cases of disease. Here, diabetes, chronic disease, and cardiovascular disease, study now as a consequence of overweight and obesity. So this is very serious. And from this, we started to compare this scenario, what will happen if we change. So first, from bottom up to reduce the increase by half. So we had the prevention of deaths related to overweight from 2.6 thousand deaths for 15,000 new cases of disease. But the impact increases progressively when we have a target that is more restrictive. So when we constrain the increase, and that is what we have in our strategy, we have a potential prevention of 5.6 thousand deaths and 32,000 new cases. And with that, we will double this impact in case we have the reduction of the prevalence in 6.7%. So it could be 11,000 deaths and 66,000 new cases. So we see that the prevalence of overweight and obesity is so high in the Brazilian population, in that even these achievements will not have an impact. So it is important to look forward in terms of this burden and use this data as an advocacy, but also, as Anna said, we will have to use the data as a best evidence and modeling the policies to have it. Just in conclusion, we didn't work with the costs, but what is expected from the findings of this study, that the increase of overweight and obesity in Brazil, we have a greater burden, even higher, and it reinforces the data that the OECD and the World Bank presented us, and at the same time, it's necessary with the priority to measure these are more cost-effective to prevention, control, and care of people with overweight and obesity to reduce this impact, and considering all the age group of the population. So the early prevention is very important because this is an intergenerational issue that is increasing in the younger people, and also considering the vulnerabilities, as we had the socio-economic vulnerabilities represented by the education level. And finally, the next steps, we are aligned with the international movements presented here. It's to work in the cost estimates, either direct and indirect. It was very important when you consider the population with disease, they die early, but also the productive economy that represents burden. At the same time, we work not only to 2030, but working with longer terms in our modeling. That's our interest in this scenario, in different scenarios as well, trying to assess the impact of specific policies on morbid mortality in Brazil, including in this package look at individual policies, and finally, the incorporation of new risk factors, which categories are very important. So working with the prevention of NSDs and the risk factors, incorporating, as said, fat trans, sodium, sugar, and salt reduction, ultra-processed food reduction. These scenarios we will have in new studies, hoping to contribute for the national health management and also contributing in the Latin America
desses estudos.
Thinking the policies from these studies. Thank you very much. Dr. Eduardo, thank you for your contribution for this debate. So now I'd like to invite Dr. Daniela Canella, professor for the Applied Nutrition Department and the graduation program in nutrition health of the Institution of Nutrition for the University of Rio de Janeiro. She is going to talk about the alignment of prevention strategies for obesity with the guidelines for the food guide for Brazilian population. So, Daniela.
Good morning, Ana Maria, Segan, and PAHO. Thank you for being with you. It was great to hear the previous presentation. So I wanted to bring this exercise of putting in dialogue the strategies done by the OECD report and the World Bank to bring a bit to the Brazilian context. And those are the starting point so the impacts in health and economic impacts of obesity in the unified health system and the multifactorial determination of obesity. And for that reason, it requires interdisciplinary actions the proposals, but in the reports and the recommendation of our food guide for the group of 2014 and children below 2 years of age, 2019, and the well-documented relationship between the consumption of ultra-processed foods and obesity. So this is the background of our lecture. I'd like to understand the strategies in the national and local levels, the strategies that for the local and municipal managers to bring. I like this conceptual model that it presented because it brings food related to the food system. This is obvious, but we need to think about the food systems that will be reflected with the population on how the conceptual model that OECD presents in thinking about the policies on obesity. They bring actions that will influence choices, will apply restrictions related to food and physical activities, and this will impact in choices. But I wanted to bring issues regarding the widening of choices and the price increase. Well, choice is a very bad term that will presume that everything will be the same condition of income. And what Eduardo has shown, it shows us that people are not the same, right? But choice is a term used in the report. Now we have the 4 recommendations, and I'd like to bring the minimally processed foods as basis of the food and to prevent ultra-processed foods. And this is fundamental. And it's important to think about that in strategy in Brazil. And the food guide brings that, well, for people are not equal for those targets to be met. And it's important to have that. And once again, bringing the choice, and there are obstacles to be overcome in that sense. Obstacles may be overcome individually, such as the reorganization of lives and priorities, acquisition of knowledge, or collective organization, but also some obstacles that will require public policies, and this is the look that I will bring. With regards to the 2 obstacles on the publicity and advertisement, and advertisement needs to be mandatorily regulated, and you must have the labeling of products and the subsidization for the decision making. And I will focus the next part of my presentation on the offers and costs that are core for the promotion of the healthy and adequate nutrition, and for that you can prevent obesity. And we have data that of Latin America and the world that shows that throughout time, in a relatively short time from the 2000s, considering 2013 in Latin America, the sales of ultra-processed foods have increased. In the case of Brazil, the purchase of ultra-processed foods and data, and possibly in the context of the food environment, the offer of these foods have increased. So it's important to look at that. In terms of, well, before the pandemic, we had a scenario that was economically advantageous to have minimally processed foods and the preparation of these foods with comparison to the ultra-processed foods. And the estimates was that in 2026, if nothing was done, the scenario would revert, and the consumption of ultra-processed foods would be economically more advantageous. But it is possible that with the pandemic scenario and the changes of prices, this has anticipated, and perhaps we would be in the turning point of purchase of ultra-processed that would be more advantageous, and this is the specific point for the actions. So I'm considering the offer and costs, thinking about physical and financial access to healthy foods as important strategies for the prevention and control of obesity. When I think about offer, I'm thinking about production, distribution, and availability of foods and meals at good costs, and the prices of the foods, and as well as the financial accessibility that is related to the purchasing power of people, and the impoverishment of the population, in fact, will be a barrier for the healthy food. In the group of possibilities, it has been mentioned the taxation of ultra-processed foods. The sugary drinks have been implemented around the world, but it's important not to be sugary drinks, but the ultra-processed in general, to have strategies of taxation. It's important to think about subsidization for ingredients and production of ultra-processed. In Brazil, we have the very weird case of sodas that has a subsidized production, and to think about minimally processed and in natura foods, but the public procurement, they're important. In the case of the food, school feeding, we have that consolidated, but the family agriculture purchases may be used in other organizational contexts, so in hospitals, universities, and the public stocks of foods, they are fundamental. In the past years, they have been disseminated in Brazil, and they're important for the control of foods. And we saw the rising prices of rice. They have to do with the disassembly of our public stocks. And in this combination of physical strategy, so you have the street markets, you have the family ones that ensure in natura ultra-processed foods at reduced prices, and the ones that are disseminated to guarantee the physical access to these foods, and also the access to the meals. They're the popular food or environments. In the past year, with the advance of the pandemic, the MTST has organized the Solidarity kitchens, but so you would take the considerations of the guide. So not to have only the popular restaurants. Not only that, but it's important the menu and the meals supplied in these restaurants to take into consideration the recommendations of our food guide. The National School Feeding Program is a great opportunity. We have evidences that show that the best adherence to that, the consumption of food in this program for more days of the week, is related to the better quality of food and is related to the lower occurrence of obesity. And school feeding, and not food acquired from home or the school cafeteria, they're related to better rates of obesity. And this is related to 2020, when the National School Feeding Program updated their recommendations, aligning them to the food guide. And now PNI recognizes that as one of its guidelines and has aligned its recommendation to it. So from thinking the menu that will decrease the offer of ultra-processed foods, but also the destination of financial resources that limit the possibility of expenses with ultra-processed foods, and thinking about a better menu. And that's why it's important the federal resources and state municipalities to take into consideration that, and ideally to advance first to have better meals in the scope, and to recognize that as a strategic space for the adequate and healthy food and the prevention of obesity. So there are organizational environments that may be targets of action. In the hospitals, university, I brought two official decisions, one of the Ministry of Health and the Ministry of Planning, that foresee the recommendation of the food guides for the elaboration of terms of reference, and they define that what can be supplied to schools in cafeterias, and this is a strategy to prevent people from the weight gain and contribute to the healthy food. And those strategies, when they start in the public environment, they can be disseminated to private spaces. And this is the moment to create the program, this workers' food program to start and to close. It is important to think about the offering costs as important barriers for the school feeding. We need public policies to overcome and to guarantee the access of people, and with that, to increase the sustainability of the healthcare system. In the states and municipalities, they're important to organize with what is foreseen in the federal level, but also developing their own actions. The healthcare services, they're important in increasing those actions, but they need to dialogue with other sectors. Part of those actions and part of what is proposed, they are not exclusive to the healthcare service. And in the case of Brazil, that we have a food guide that is very important, well updated, taking into consideration the new classification, recognizing the ultra-processed foods as an important element to be considered in food, in nutrition, and all of that must be aligned to our guide, and to understand how harmful the ultra-processed foods are. That's what I wanted to bring. Thank you very much for the opportunity. Daniela, would like to thank you very much for your participation in your presentation. Was in dialogue with the questions that we've had in the chat that ask or question how do we widen the access to food, and they're important markers for healthy eating habits, and how we build policies that allow the availability of these types of food. So it was great, it was very enriching to show possible paths for us to build policies that look at this access and availability of foods. I'd like to thank Dr. Daniela and also Dr. Leandro and Dr. Eduardo, who have contributed to this debate, bringing the perspective of this situation in Brazil and pointing out strategies and possibilities of advances of public policies of food and nutrition towards the prevention of obesity. And continuing the presentation, now I'd like to invite Dr. Fabio Gomes, the Regional Advisor in Nutrition of the Department of Non-Communicable Diseases of the Pan-American Health Organization. Thank you, Fabio.
Thank you, Anna. Thank you all, everyone involved in the organization of this webinar of today. And it is important to draw our attention to this issue and how important it is, not only the day of today, the World Obesity Day, but also to translate this information into solid actions so we can really change this reality that we are seeing. So the set of speakers today is wonderful. And just to read some of the comments that are important for our reality of today, the action and the necessary change in the Americas region, it's quite clear by the different presentations, in particular from OECD and World Bank, on how evidence is quite clear for us that obesity has as an outcome for all the countries, but in particular for countries of low and medium income, for that population of low and medium income, populations under situations and conditions that are even more vulnerable, are making us live less and spend more, produce less, and have more hardships to be on the top market. So we have an impact. It is not an impact that concerns only the health sector. It's not by chance that the OECD and World Bank, they have interest in these issues, and they are working and supporting because the fact is not only on people's health or the possibility of it impact only the health sector. So it's a problem that affects all the dimensions in the society, all the sectors of the society. So I believe that the message for this year, in this World Obesity Day, is in this sense, that the response shall be understood as a response that will affect and shall involve and engage all the necessary actions so we can tackle this problem. And one of the things that was very interesting, it was regards to the solutions beyond the problem, in addition to the problem. So it's clear that the problem affects the society in different dimensions, including on the socio-economic development of the countries. And I used to say that these pressure and the negative effects of obesity on economy and socio-economic development and the financial impacts, they do not protect even the industry that is behind the construction of this epidemic. It doesn't benefit the industry. So we have data, for instance, of studies that show that the costs, including for the industry of ultra-processed products, they are higher with regards to the impact that obesity has on health and the employees of these industries as well. They are being affected economically, financially by the obesity epidemic. So in this sense, it is important to advance in this agenda, and it's clear that from a perspective that is a short-term perspective, many of these companies, they are the main source of resistance for solutions in the countries that we know. And getting back to them, it was well said here, the experiences and the solutions, none, and already apply it in force, we have solid results. So among the different actors and stakeholders, it is important to disseminate the acknowledgement that regulation and the efforts from many actors in the market sector and the government actors, the Ministry of Industry and Commerce, they resist regulation as it was something that would help industry and economy of the country, while it will compromise actually the industry and the economy of the country as well. So we are not talking only about a problem that is expensive to one sector and it will impact only a single sector of the country. And with that said, the support from ministers, the support from ministry in different levels of the government and related to finance, the economy of the country, the industry of the economy, shall be aligned with regulatory policies so this benefit can reach the whole population, including the socio-economic development of the country. And I think as we saw the projection, what would happen if we were capable to reduce the composition or improve composition of these products. But on the other side, we see, and in different presentations we saw that how the Latin American has been a set of countries has been showing results where we were working as projections and scenarios that today we can find real. So Chile, with the reduction mentioned in different occasions, reaches in 1 year what is aimed or what is the projection to reduce in 4 years in other countries. with some voluntary measures that are the measures that some countries are still developing. But we know that it works. We know that the combination of regulation, labeling, warning labeling on the front, the application of a lot of these related to advertisement restriction and the restriction of these products in the schools, and also the taxation, it has the capacity to reach these results. In particular, for instance, the calorie reduction in Chile in less than a year, with the most, it's not the most rigorous criteria, but it's in the first phase, they reached the reduction of calorie in procurement in 16%. If we add the taxes, it will reach the 20%. That we were working in some calorie consumption reduction scenarios. So we know the solutions. And what is important here is to give space to innovation and advancement of these solutions more than finding excuses to not starting and winning. And most of the countries that didn't take action, they spend their time trying to find reasons to not start. And we had, as the presentation of the World Bank, that not taking action has a cost as well. It's not that we are waiting to see and find the best solution, but it actually pauses the cost that have for health and the society as a whole. So as we know, there's a cost, and we know the solutions that are being designed. It's important for countries to take action and continue to advance in these policies and evolve in these policies. It's important for countries to take actions always towards the improvement of what has been learned. It is important not only to be omitted to that, but also not take actions that is a step backwards. So we have to be all the time aware about that, because unfortunately some sectors and of the industry, in particular those who are benefited by the expansion of the ultra-processed market expansion, they will work exactly trying to move or to continue with this status quo, or of no action, or trying to witness the actions that has been involved in some countries. In Brazil, we have in Latin America examples on how these policies were improving the school nutrition program in Brazil. Is a program important, and every year we give legislative and regulatory steps to improve according to evidence and the experience from other countries. And now Brazil has, with its neighbor Argentina, a project that is approved to restrict advertisement, the warning, labeling, ultra-processed products restrictions in schools, that goes towards of what we learned with Chile and Mexico, with restrictions and warnings for products with added sugars. We know that the evidence shows and evolves, and it's showing in a solid form the impact that sugar has on overweight and obesity in the long term. So it is important to highlight today the need of governments to advance with the regulatory agenda, with solutions that we know, and improving these policies, trying to gain this recognition and advocate for the recognition of government actors that represent industry and commerce, that such measures, they are fundamental, including for the sectors that they work on. So if we think on a development as a whole, we need to have the full support from the government, and showing that the effects of these regulations will benefit the society. This is my message. I'd like to thank the opportunity and thank you very much. Fabio, thank you very much for your participation. Thank you for your comments and your contribution to the debate that links the needs of the health, economy, and other society sectors. Now, I'd like to give the floor to Dr. Jizei Bertolin, that is the General Coordination of Nutrition and Food of the Ministry of Health, and she will give us a final comments on the presentations and give us an overview of what Brazil has been doing and some products released that are being developed by our coordination. So, Gisele. Good morning, good afternoon, everyone with us. First, I'd like to thank for the wonderful debates, the General Coordination of Nutrition and Food and Ministry of Health. Our team has been working to promote these debates, trying to find solutions. Many of the solutions are we have with many of evidence showing what is the right path, and these are paths that needs to be followed. So I'd like to thank World Bank, OECD, PAHO, Dr. Eduardo, Dr. Leandro, Dr. Daniela that contributed with this excellent debate on how obesity impacts on the economic burden of a country and the financial sustainability in case of Brazil of the unified health system. When the Brazil health is a right for all the Brazilian people and is a state's duty. And in addition to that, it's important to mention that as health is a right in Brazil, food is right in Brazil. So these are gains for the Brazilian population that strengthens the public policies. So before speaking briefly of what Brazil has been doing, I'd like to acknowledge, recognize that obesity, agree with everyone that obesity is multideterminate and there are complex solutions. And also to recognize that our work start the point that obesity is not only an individual issue, but also the environment where all of us are impacts on choices and opportunities. So it was really nice to listen to World Bank and OECD talking on documents that support us in the strategy elaboration, that is the Proteja document that tries to promote healthier cities in Brazil. So I'm going to share my screen. Before sharing my screen, I just want to, just not to repeat myself, but in Brazil, we have an increasing number of people with obesity through the years, and also we have a proliferation of the consumption of ultra-processed products with the obesity increasing. So it shows us a great concern for the Ministry of Health. I'm going to share my screen, and I need just you to let me know if it is one or two screens. It's one screen, but it's not in the presentation mode. What about now? Not yet. It's not in the presentation mode? No. Let me try again.
E agora? Foi, agora sim.
What about now? Yes. Well, from where I speak, this is the General Coordination of Food and Nutrition that is responsible for these policies within the unified health system. What is a huge challenge, because we know the obesity solution, it requires the coordination and efforts from different sectors. The Brazilian food guideline, Brazil, as Dr. Daniela said, brings a lot of recommendations that point that the Ministry of Health standpoint is guidelines and recommendations that will protect Brazilian health. But in order to develop and implement them, so the Brazilian can consume less ultra-processed products, more natural products, we need a number of measures to be implemented by different sectors, and it's challenging. Brazil has been advanced as the school food program, but we have a lot to do and learn with experience with other countries. So briefly, to finish, I'm going to talk about the actions in the unified health system, because today we have 96 million Brazilian people with overweight and almost 4 million Brazilian with obesity. So there's a number of actions implemented by the unified health system, since the primary care to surgery interventions and the protection. There is an action that we launched last year and was inspired on the document from the OECD and World Bank to promote, to foster healthier environments for children and their families, and some products that strengthen their self-care support. That is a strategy within the management of people with chronic disease. So as was said, in Brazil we have the national plan on NCD and the national health plan that recognize the obesity as a problem, and it is committed by targets. And on the federal standpoint, how these actions within the health systems are implemented. So the Minister of Health allocates funds to municipalities so they can organize the specialized and primary care services. In Brazil, we have the nutrition and food surveillance that organized within the health system, the primary care, that enable us to understand the time evolution of overweight, and also the consumption of some food. And it allows us to understand the scenario. We are investing in permanent education program, because in Brazil we have more than 4,000 family medicine workers. That is the primary care service close to the domiciles of people. And today it promotes the care and action, these actions to individuals with obesity, the surgery interventions, and the Ministry of Health also invests in a number of research as Professor Leandro brought. It's a research promoted by the Ministry of Health, and a number of communication strategies. So just to show, there's a number of materials available for the professional health, the health work professionals on surveillance and care, and a number of courses available for these professionals for free, with the aim to train these agents and health professionals. And here, a number of materials and publications. Brazil since 2014, we have the Food Brazilian Guideline, that is a world reference, and recently we released the Food Guide for Brazilian children below 2 years old. And this is an attempt to disseminate and reach the different audience with this information. So we have this course and materials for health professionals, health workers, a platform that we named Saúde Brasil. That is a platform that is a dialogue with the population that shows important information and reliable information as communication strategies. And on the Proteja program, there is an action that we have been investing since last year, this year, and the next one. There is an action that includes 1,320 municipalities. In Brazil, we have more than 5,000 municipalities, and it's a huge challenge in implementation of any public policy in Brazil. This first cycle is an action, 3 years, where we focus on 1,320 municipalities. The Ministry of Health allocates funds in these municipalities, and they are committed to undertake a number of actions, a package of actions. As was showed by the OECD and World Bank, there is importance to promote a number of joint actions locally. So this is a work for the Ministry of Health to promote locally an intersectoral organization to promote more healthier lifestyles. There are also a number of communication campaigns for families. This past campaign was named Everyone to Take Action, recognizing that all the sectors, family, public managers, they have important roles. So still within the Proteja program, there is the action to promote healthier cities. These 1,300 municipalities, they will implement a package of actions that we name essential actions. So these are 20 essential actions. There are a number of actions for primary care in schools, governance, communication, and also the environments. So just to give an example, we strengthened the implementation of the School Food National Program that restricted the offer of ultra-processed products. An action that we consider to be essential is that these municipalities, they need to guarantee health kitchens in these schools to promote municipal fairs and planting, and also the physical activity component. Brazil last year launched the first Brazilian guide on physical activity, and this action also promotes induce the municipalities to look at these spaces and think how the city can support and promote the physical activity. These are the essential actions. In addition to these actions, essential actions, we have 21 other actions that are for milk bank or to close a street in the weekends to use to physical activity. So the municipalities choose at least 5 of them to implement. So these are our proposals to promote healthier cities. So, and what is new today, well, are the updates of today, we are pre-launching an application within the application Pessoas, Saudável, Healthy Weight, the Connect SUS, that is a reference in what's recognized by generate the vaccination certification. Within this application, there is the Pessoas Saudável health weight feature, and this new version will bring a new feature to strengthen the self-supported care. There is a 12-week action where the individual, once connected, it can test, assess their food, their nutrition, calculate these numbers, and every week it has information and challenges per week, either for food or physical activity. So this is another tool to support individuals that go to the health facilities and supported by the health workers, especially in a moment where they have no contact with these health cares. Also, it's a pre-launch in the next week. We will have a new group of capacity building for primary care health professionals with this attention specifically for people with overweight and obesity. So I'm just announcing that. And finally, the launch of this material, there is a material for a pre-counseling for individuals with obesity in the health primary care. So in the Brazilian primary care, trying to interact with those who are not in Brazil. I think we are quite happy and proud by talking of our primary care. Of course, we have a lot of challenges, but we have a system, a digital system, that allows us to have the information on Brazilian population, and within this information, we have weight and height information of the individuals, and also some consumption markers. So it is possible, for instance, the adult population, there are 6 indicators that evaluate the positive and negative indicators in their diet, and from this information with the food guideline, we elaborate protocols, therefore rapid counseling to support the family medicine and the consumers and the individuals that for health services in our health facilities for diabetes and cardiovascular disease. And once we do that, we try to include the food and physical activity approach jointly with other treatments. And here, just to an input for dialogue and the moment of today, is the fact that all of us, we need to act. The importance of strengthening the intersectorial discussions to advance and create healthier cities and healthier environment for all Brazilian people. This is the contact for those who have interest in to do work and discuss with us and support us in this debate. Thank you very much.
Thank you, Gisele. Now that we have Dr. Mira and Dr. Michele, they are still with us. A question came up on the chat directed to them, and if possible, I wanted them to comment on, well, Daniela Canella has brought the increase of evidence or the impact of ultra-processed consumption on obesity and other NCDs. And the question that arose on the chat was how the OECD and the World Bank have been discussing policies that influence access and availability to ultra-processed foods regarding the strategy of prevention to obesity. Dr. Mira and Dr. Michele, please.
I'm sorry, Dr. Mira, but we're not. Okay, thanks.
Yeah. Yes, thank you for that question. From the World Bank side, first let me say I've been listening on to the conversations, and it's very fascinating to see what Brazil has done, and really encouraging, and I hope we can take some of the lessons from Brazil to other countries as well. On the question of how the bank is supporting countries in the area of ultra-processed foods, first and foremost, we are trying to collate more and more of the evidence so that we can take an evidence-based approach to countries. And secondly, we really work on a demand-based model. So when countries approach us to say, what is it that we can do, we then provide policy advice to the countries. We also work with countries through either World Bank credits or what we refer to as either investment lending once an area has been identified, or perhaps more suited to this approach is something called development policy operations, where we agree with countries what policies they would like to promote, and then we allocate resources associated with those policies. So particularly in this area, we are demand-based. So as countries approach us, we give them the best possible advice, but also then based on demand, put in place development policy operations that support the implementation of those strategies. So let me stop there. Over to you, Michele.
Thank you very much, Mira. Let me complement on what you say to provide the OECD slightly different point of view. First and foremost, OECD is a forum for countries to discuss together issues on which they have a common interest. So the way in which OECD supports countries is primarily to identify best practices across countries, allow countries to present these best practices, talk one to the other, learn one from the others. So that's one way in which we support countries and we help countries supporting themselves fundamentally. Another area in which we have advanced, I think, a little bit the discussion is on what countries can do to support industry in making the change. We recognize that food industry is part of the game, whether we like it or not, and there are a number of actions that countries have been putting in place to modify the food. And I'm not just talking about regulation, but also, for example, from Chile, just to mention one from the region that works together with industry to put incentives, whether it's public-private partnership, whether it is to facilitate work with academia, to find alternatives to this type of products. Then, of course, there is also the work we do bilaterally with countries to support them in action, or to gather evidence and data, mainly, as I said, through best practices. Over.
Yeah, if I can just add to that if this is an area of interest for Brazil, I think it would be helpful, as Michele said, to bring together a group of countries and encourage peer-to-peer learning across the countries. And if that was the case, I heard that from Michele, but from the bank side as well, we'd be happy to participate in that effort and help bring countries together and the experiences, the best lessons from countries. Over.
Muito obrigada, doutora Mira.
Thank you very much, Dr. Mira and Dr. Michele. Once again, I'd like to thank you for your participation and your presence here with us. And besides thanking the OECD and the World Bank to be here with us, I'd like to thank, in behalf of General Coordination, Well, I'd like to thank the University of Brasilia, the Federal University of Rio Preto, and the Federal University of Santa Catarina, CGProf, DataSUS, on helping building the materials that we have presented here today, in the construction of actions, and also in the development of this very event. And with that, we're closing today's event. And once again, I'd like to thank the presence of all of you who were with us throughout this period. And we'll continue building strategies and policies and structuring points to try and revert the obesity scenario and strengthen the perspective of prevention and care with an encompassing look that considers the determinants involved in the process of disease and health. Thank you.